Stay where you are. Stay where you are. Join you.
That's where you must.
Your mask, come on. Thank you. Take it up. With pleasure. Thank you.
Give a chance to drink. Give a chance to drink.
Thank you. Listen. Thank you.
Hey, Elizabeth, what's that? Elizabeth.
Someone is taking it.
Where's Elizabeth?
I need one for my son. He has it. Elizabeth, let me drink.
Okay.
Mr. Brown.
Now, suppose the camera is
Yeah, Elizabeth.
Ma'am, just where you must.
I like this side.
Just where you must.
okay.
I can't really say.
You are seeing, ma'am. You're blocking the other.
You haven't 10. You haven't 10. There you go.
You must. General.
Thank you very much. Stay where you are. I'll come behind. Are you still behind it? Yes, sure.
Okay. We can try that. Yeah. Thank you. All right, thank you, sir.
Okay, now, you were multiplied. Come. Take another shot. Now, look. Are you related, sir? Thank you very much. Thank you.
Okay. Just where you must. Follow, ma'am. You must.
All right. Right, let's take a shot. Okay, where's the camera? Yes. Okay, great.
Let me just in here.
Yes. Good.
Okay.
You take a selfie? Take a
Yes.
Okay, guys. Thank you.
So that's the way you are?
Yeah.
Right here.
Right.
Last one night.
Okay, so thank you so much, Your Excellency. Thank you so much. I think it has been an over 2 hours of a closed door meeting. We just want to get an update from you, what was discussed, and more especially to the critical matter of our life and death, that is the shortage of drugs in the country.
Yeah, I think first and foremost, we are delighted that we came over here to have an interaction with the Ministry of Health on a number of issues, but particularly focusing on how we can work together to ameliorate the perceived or real issue of drug shortage in our health facilities. So we have had good conversations around this issue to isolate where the challenges may be. Hear me? To isolate where the challenges may be and basically how to resolve those challenges, working as a team with the ministry with an intention, single-minded intention to ensure that drugs are available for our people when they are in need of those drugs. Not in one location, but across the country. And the meeting revealed to us quite a number of issues. Some are straightforward and are being dealt with. Some require a bit of interrogation. But there also appears to be a mismatch between what is being said and what is actually on the ground. Why do I say so? We were able to engage with the provincial medical officer. I think all of them almost. In the 10 provinces, we had a virtual meeting after our first stage meeting with the minister and team PSs and others, and then we engaged the provincial medical officer who gave us the situation on the ground. So hopefully the publicity side of the ministry, minister and PSs, you now pick it up to deliver the message to the public as to what the actual situation obtaining on the ground is, so that we take out distortions and remain with facts. Facts is what we should work with, nothing else. Other matter that we were dealing with is, you're aware, is the recruitment of 11,000 plus medical staff. We covered that area as well and looked at the issues at hand and made sure that we don't continue with the recruitment process without dealing with issues that may result in maybe misapplication or misallocation of the medical staff as required on the ground. So again, we spend time to look at what's on the ground, what health facilities are on the ground, what do they need most, right? I'm talking about priorities here. I'm talking about the combination of those priorities so we can overall improve the patient to medical staff ratio so we can improve health services delivery. That's what we're doing this morning. This is only the beginning. I think there are work streams, there are activities that will follow from here to make sure that what we do it correctly. We do it properly, and we do it at the right price. And obviously quality of delivery. Overall. That's what we're doing here. This should be normal. This should be normal going forward. Today you will see at the Health Ministry. Tomorrow the President will be at Lance. I may be at local government, or maybe elsewhere. This is something you must expect going forward. That's the message. Because the President's office is not state house. The President is a servant, working with ministers, working with permanent secretaries, working with yourselves to make sure that we improve service delivery to the people. So you better get used to this.
This brings me to my other question. I think it still remains on the issue of the drug shortage. Your Excellency, since you've been here, how can you describe the situation? How bad is the situation in the country? And also, just to find out, in the 2022 budget, there was 3.8 that was allocated to the purchase of medicines and medical supplies. We are also aware that about 2.2 billion is owed to drug suppliers. Is this the same money that is going towards the servicing of the debt as well as the purchasing of drugs?
There are legal issues in the health sector as they are in different ministries, different sectors. There are legal issues. We all know that the country was not run well. We know that. We must accept that. Instead of fighting this fact, we must accept and start from there. So there are legal issues of maybe amounts that were owed to suppliers in the past. They're there. There are legal issues in the fuel. You know that, isn't it? I'm just grabbing a little bit, crossing over, of unpaid bills. What we're doing is unblocking these legal issues, but at the same time making sure that going forward, we don't create new inefficiencies in the way we run sector, health being one. But also, we make sure that we stop being wasteful. As a country, we've been extremely wasteful, and we've made things that are not correct to be viewed to be normal. No. So we are having a myriad, a package of these issues. The code name, the code way is to improve service delivery and not be hung up by the ills of the past. We are aware of the ills of the past. We want to make sure, and we are making sure, that drugs flow. Also that when we buy, the minister has been working on, and we as a country, as a new administration, as an administration, these are issues that we as teams in different ministries, in different occasions across the country. So your question is not really, should not be narrowed to a particular fund here. The good news is that talking to the provincial medical officers, they are all confirming, they've confirmed that, and there are purchases when those purchases are needed to close a gap. That could be a temporal gap. What do I mean? Particular drug type is not available from the floors at the center. Remember, we are organizing the center as well, and with the new leadership. I'm very pleased with the interaction we had with the new leadership at ZAMSA. What used to be medical is now available, and then the purchases can take place as and when the particular drug line or type is not available from the central floor, or flow from the center, as it were. But also the utilization of these drugs, the utilization, the consumption at the point of utilization, a clinic, a health center, a hospital, must match with the buying processes. In the past, it wasn't matching. We're working to do that. I'm pleased that the team and us and you yourselves must be singing for the same issue.
Go ahead. No, I don't have any question. Yes, please.
So the camera.
Thank you. With regards to the recruitment, what has been finalized, not just for health workers, but consistent statements from some of the ministers with regards to health workers. Just
The
speak
stay,
about that.
the stay with health workers. I think I covered it. I said two things. Drugs flow from her person, and then they're doing it properly. And I think the processes will be articulated very soon, and you'll be very pleased in the sense that we are matching the health facilities across the country with the personnel needs. Medical personnel, but also skill sets. It's not just doctors, we get it right? It's not just doctors, please. I think the minister has been explaining, it's not just medical doctors, it's health staff, health workers. I think it will commence, it will continue. The advert is coming on when? Tomorrow the advert is coming out. But we are also focusing on inclusiveness. In the past we have recruit only certain people. Jobs in the public sector must be available to all citizens fairly across the country. That's part of our agenda to reunite this country. So you see that those are some of the components. It doesn't have to be a nurse take their own day. I'll be at education someday. Come along, we'll discuss. But it's similar issues to make sure that we are doing it properly and we are, again, inclusive. Job opportunities in the public sector, direct local government, parastatus, we must be inclusive. We must take care of all this. We are elected into office to serve the whole country. I'm sure that is important. It is not
Thank you.
You don't even need this. Why do you use this? It's totally enough, right?